Hello.
Hi there. How are you, Nikki?
Hi, doing well. All right. Hey, everybody. Thanks for joining us today with Lifestyle Telemedicine. I'm very excited that we get to talk with Dr. Sandra Musial. So thank you so much for being here with us.
You're welcome. I'm really happy to be here.
Yeah, and so just briefly, I'll just tell you a little bit about her, and then we can kind of get into kind of her background and what she currently is doing to help people who are interested in improving their lives and improving their health. So, Dr. Sandra Musial is a medical doctor, a physician who specializes in food as medicine. She has been dedicated to preserving health and reversing lifestyle related chronic disease through whole plant based nutrition. She is a culinary coach from Harvard's chef coaching program, has a certificate in plant based nutrition from eCornell, just like me, and a health coaching certificate from the Institute for Integrative Nutrition. She's also triple board certified in not only lifestyle medicine, but also pediatrics and obesity medicine. And she started an obesity clinic and the first vegetable garden at Hasbro. Now, she also started a nonprofit called Plant Docs, and that's a lot of what we're going to be talking about today. And now, Plant Docs is an avenue for people to learn more about the power of plant based nutrition to improve their health through month long immersion courses, hands on plant based cooking classes, and then private MD nutrition consultations. All right. So, Sandy, why don't you tell us a little bit about, what a little bit about your background, just kind of you've done a lot of things and you're obviously like very much into this lifestyle medicine movement and whole plant-based nutrition. But I'd love to hear a little bit more about like where things kind of started out.
Sure. Thanks for that introduction. I um, I would say it really goes back to childhood. My interest and kind of fascination with nutrition has been this lifelong love, and it started really with an awareness in my own family because my father's dad died of a heart attack, and so he did all this research to try to figure out what he could do differently so that he didn't have a heart attack. And he really did make a lot of lifestyle changes himself, hiking up the hill behind our house every day. He had smoked in the past, like he was in World War II and that's when he started. And I guess he said like everyone smoked, but he had quit a little bit before I think everyone else. But it was really the food that we started, I started noticing changes. We stopped buying red meat. We started taking the skin off of the chicken. We stopped deep frying foods. And I remember just thinking, wow, like there's this connection between the quality of the food that we eat and these health outcomes and this early death of my Uncle Mike. So I decided to study nutrition as a major when I went to the University of New Hampshire. And then when I decided to go to medical school, I remember thinking, this is kind of a bonus. A lot of people that apply to medical school don't have this nutrition background. And people were very interested. I remember on the whole interview track asking me about nutrition and why I was studying it and why I was interested in it. But interestingly, in medical school, as you know, there was very little nutrition. So I remember thinking, good thing I spent 4 years studying nutrition as an undergraduate because we really got barely anything. There were a few lectures I remember talking about some of the population studies. Like I think it was the Korean War soldiers, where they, after the Americans and the Koreans died in battle, they compared what their coronary arteries looked like, the Korean boys versus the American boys. I don't know if I have that right. Do you remember this study that I'm talking about? Yeah.
Well, I feel like I've heard in general, and I don't know if it was, and this might be different, but I had heard of a study that was looking at young men who had died in battle, and basically looking at these young men that were in their 18 to early 20s and already starting to see the signs of atherosclerosis and heart
Yes.
disease.
And what struck me in medical school was the Korean boys hardly had any sign of disease. The linings of their arteries were clean, like young children, like they should be, right? And the American boys already had early signs or more of coronary artery disease. They had early plaque being laid down and fatty streaking and from an unhealthy Western diet. And that was just like the one study that I remember from medical school that was like, wow, like this is really profound. These are young kids where you're already seeing this difference.
And that's pretty incredible that that was, I mean, I know you got very little nutrition education, but the fact that they actually showed that
True.
and talked about that, I mean, that's more than what I got, definitely.
That's true. I do appreciate that. Um, and then after I came to Rhode Island, that's where I live now. I came here for residency, and I fell in love with the whole pediatric population and did a lot of focus work on nutrition within pediatrics. I became a lactation consultant and spent a lot of time talking about nutrition. And early on, what I had learned in medical school is like, we need cow's milk. Children need cow's milk to build strong bones. And that was this like rhetoric that doesn't seem to be very evidence-based, that was really kind of pushed on everyone, right? Everyone still believes that. Like it's a little bit brainwashing is what comes to mind. But I had this one patient that came to me in my private pediatric practice who was very educated. And she had this kind of cutting edge doctor who had told her to read the China study and told her that her children shouldn't be drinking milk. And so this was all like, what? This doesn't sound like science to me. And I
Yeah.
and I didn't realize the China study was a book by T. Colin Campbell, really doing a deep dive into nutrition and health. And then there was a second incident about a fellow weaver of mine who I was taking this new weaving class. I joined this group of women, and there was one woman who would come and she wouldn't weave because she had such terrible eczema or psoriasis on her hands. They were cracked and bleeding, like she couldn't handle the yarns. And she started talking about her doctor who told her to read the China study. And Rhode Island's a small community, right? So I'm like, this has got to be the same doctor. And so she started talking about these new foods she was introducing, all whole grains like quinoa and farro. And everyone was like, what's quinoa? This is probably like 20 years ago now. And cutting out milk and dairy. So then we started chatting, and what fascinated me, because at first I was skeptical, but every week she would come to weaving and her hands were getting clearer and clearer. And after about 5 or 6 weeks, she was like, I can't believe this. They've never looked this good before. And so I was like, okay, what's that book? And who's your doctor? And, tell me more. And so then that's when I went out and got the China study, read it. And it was really a pivotal book for me. It's kind of like, I remember it included the study about the Korean soldiers and many more, sightings of different population studies and research that had been done. And I'm like, it was very troublesome actually to me because I felt like I got this excellent, you know, education, an MD education in the United States, which I felt should have the most recent information, that's all research based, right? And I felt like that wasn't so, like that they really weren't keeping up with the most recent information about nutrition and health, and that I had to find it from a book seemed kind of ridiculous. And that just started me down this kind of probably a similar path you have done, where I'm like, where can I get more nutrition information that's really like the truth, that's based on evidence? And that's what led me to, I was going to get a PhD in nutrition. I was like, what are my options? Like, how can I learn the most I possibly can? And so that's where I found the eCornell course. And then I was like, well, I'm going to do a not a fellowship, get board certified in obesity medicine. I took the course at Harvard. I'm like, this has got to be the best information in the world. And
Yeah.
even there, like, I was just shocked at like the lack of science that they were using as part of this board certification. It felt like it was already outdated because the process of, what's required for board certification, what they're going to test the physicians on, there's this lag, right, from the time the science comes out till it makes it on a board question and then part of a board course. So anyway,
So with that, did they talk about nutrition when you were getting board certified in obesity medicine through
sure,
Harvard?
but I felt like it just wasn't enough. It was these studies that I felt like weren't representing like the big picture. They were like, I remember one study where they were comparing different diets, and they were just looking at macros, which, our country's obsessed with. So they were like
Right.
high protein, low carb, or, high carb, low fat, or high, and without looking at the details, like, well, what kind of carbs are those? Is that, pastries and white bread, or is that farro and buckwheat? Like, it matters.
Right. It does matter. Yeah.
And, and to me, like, that's one of the biggest faults in so many of these studies is the lack of those details. It's hard to do these studies, but they would draw conclusions saying, oh, like this high protein diet is better, low, so carbs are all bad. And it just was very frustrating to me because I just felt like this is what we're being tested on. This is
Mhm.
what all the doctors in America who are getting board certified in obesity medicine are learning. It it was
Right.
it was really disappointing to me because to me, that was like the best education in the world that I could get, and it wasn't good enough. I don't know,
Yeah.
it wasn't.
Yeah.
So, yeah, I was really kind of disappointed with my whole profession. And not just that, and, I could go on and on, but the healthcare system and the way our healthcare system is structured and how, like, we would see children who are, as I'm a pediatrician, I'm just seeing all these conditions like type 2 diabetes, obesity, early heart disease in children, hyperlipidemia, getting worse and worse and worse on my watch, right? So while I'm a doctor, everything's getting worse. So clearly what we're doing is not good enough, right? It's not the right approach. And if I
And
wanted to see someone for like a child with obesity, I had to like, oh, we had to make up other codes like, were their liver enzymes elevated in order to get paid to give them nutritional advice? It just seemed all wrong to me. We weren't valuing the whole preventative approach to healthcare.
right, right. And then here to be someone who is, I would say, educated to the nth degree, right? You should be the person that knows everything about what it takes to help a child who is obese because you're, trained in pediatrics and obesity medicine. And to feel like your education was lacking as a medical doctor, board certified in those is just incredible to me.
Yeah.
And it, I mean, this is really, I, it's kind of a way to like open up that curtain and like take a peek behind and see why why are we in this state that we are today. It's certainly not because the medical profession has figured out how to help this epidemic that we're seeing. And then of course now we bring in lifestyle medicine. Right, that's kind of the answer that a lot of us have been looking for. How
Right.
do we get back to the root cause? How do we get to the, what is causing this issue to begin with?
Yeah. So my first look into lifestyle medicine was Nashville. I forget what year it was. It was an ACLM conference. It wasn't the first one, but it was early on. And I really, I had heard like functional medicine, anti-aging medicine. There were like all these terms floating around, and I didn't really know the difference between any of them. But when I went to that conference in Nashville, I was like, this is it. This is science. These are real doctors. Like, they're practicing like valid stuff. It's not like that was one of my biggest worries. Like, I felt like I knew what was right, but there was no like definition for what I wanted to do. There was no lifestyle medicine at the time. There was no like nutrition tract for a doctor to specialize in. It just didn't
Yeah.
exist.
Right. It
And
was
even
missing.
plant-based nutrition, that whole term didn't exist. So if you were like
Right.
vegan, that was just like weird. It wasn't like that was like a cultish thing, not like a reasonable, rational decision for a nutrition choice. So
Right.
I didn't want to get put in this weird place of like quack doctors. And I felt like I was at risk for that if I left my mainstream medicine groups, which, I'm at Brown University, and like I wanted to stay associated with reputable physicians. I didn't want to be like that one doctor in the state that was, perceived as kind of practicing out there and not like not
Right.
evidence based.
Right, exactly. And that's what I think is so wonderful about this lifestyle medicine movement is that it is evidence-based. We're not it isn't quackery, right? We're
Right.
not just throwing stuff out there and saying, "Ah, this should work, let's try it." It worked on one person. We really are looking at the studies that have been done, and there's so much evidence out there, so much research that's been done, thankfully.
Yes.
Right? It wasn't like that 50 years ago. I mean, now we just have this abundance of evidence, and I talk about this a lot, like kind of like what it was like when it was still supported by doctors for people to smoke tobacco, even though we had a lot of evidence to support, that it's bad for your health and it causes lung cancer. It took a long time for the Surgeon General and the entirety of the medical field and the public to finally say, okay, yes, this is a bad thing. Um, so I feel like we're kind of in that same place with plant-based nutrition and lifestyle medicine in general, is it's like the evidence is there. Truly, we don't need more studies. I mean, at this point, I feel like there's enough. And of course, it helps to have more, but we know enough. And I mean, let's talk a little bit about this. So you and I get to see firsthand what happens when someone improves their lifestyle, and specifically when someone chooses to move from more of a standard American diet that is heavy in processed foods, animal foods, and moves toward a whole food plant-based diet, what that does for their health. So even though the evidence is there, we actually get to see it firsthand. So tell me about, first of all, what you do currently in your practice, and kind of maybe a case or two of things that you've
Sure.
seen.
Yeah, so I left mainstream medicine and started Plant Docs, and it's structured as a nonprofit because at this time it's just not right. Like we're talking about, it's not valued. It doesn't really fit into everything yet. It's just inevitable, right? That everyone's gonna start
Yes,
to see this. I know
I
we're
like
in
that attitude.
Yeah, we're on I like to think of it like there's this big wave coming, and we're just at the very front of this wave, but it's inevitable that everyone's gonna get it eventually, right? I'm
Yeah,
an optimist, but
me too. Me too.
right. So one of our main program, the one that we started with, that's my favorite, is called Jumpstart Your Health, and it's a month-long program where we teach people how to eat whole food, plant-based, how to cook, how to read labels, how to shop. We demystify cooking with legumes and leafy greens and what is a whole grain exactly and like what does that mean and how to make delicious sauces and dressings without using artery clogging oils. Like, so every ingredient, this is what I tell everyone, every ingredient has gifts for your body, phytonutrients, antioxidants, vitamins, minerals, things that are only going to benefit your health, not take your health away.
Yeah.
So, because I know a lot of doctors say, like, oh, well, eat more greens or eat more veggies or, cut out that white rice. But
Right.
how do you do that? So I felt like an important part of this program was teaching people to cook again, especially there's so many generations like that I was working with at Hasbro Children's Hospital. The parents are only 20 and their parents are 40. And now it's going a couple generations back where nobody knows how to cook. They don't even know how to cook broccoli. That's why I started the garden there, because kids don't even know what a tomato looks like. They only know ketchup. So
Wow.
that
Yeah.
was our whole demonstration garden, like taught children what vegetables look like, how they grow, and hopefully inspire people to, grow their own in their, urban backyards, because it was all like vertical gardening. But anyway, I
Yeah.
love gardening.
Well, I love that because I think you're absolutely on it. I mean, people don't get to see the food where it comes from. And then the other thing is I think a lot of people lack that. I've heard this term before, kitchen confidence,
Yeah.
right? And
Yeah,
I
it
think
just
I've taken that for granted because I feel like I have kitchen confidence.
I love
Uh,
that word, kitchen.
and it's kind of like it's just there, right? And I guess I have taken it for granted where I just don't realize like what a gift that is to have, and how there are people out there that are so overwhelmed by the idea of stepping into the kitchen and not only just cooking in general, but also now trying to cook something completely new that they've never cooked before. I think there's really something to that, just getting down to the basics of, you know, just those skills to be able to just cook, like you said, broccoli. I mean, I think a lot of us don't even consider that that's something that people would struggle with. Being able to properly chop, knowing how to use the different tools in the kitchen.
Yeah. So it's interesting because when we started the Jumpstart program, it was before COVID. So we set it up, it was live, so before Zoom, and like it seems so foreign now. Everyone would come and would gather in it was actually in the cellar of a plant-based food hall in Providence, Rhode Island called Plant City. And so it was like I loved being part of that whole movement. And so we would do these cooking demonstrations and then people would taste it. But that doesn't increase your kitchen confidence, right?
Right.
So during COVID, we had to take a break. And when we restarted, we weren't ready to eat together yet. Everyone was still masked. So we are like, let's do these remote cooking classes over Zoom. And it was completely foreign to me. And that's why I found that Harvard chef coaching program, because it teaches you to teach cooking remotely too. It was very specific. And I was like, this is perfect for me. So we started these remote cooking classes where we'd be like, see, this is the kale. Here's how you strip it. Here's how you chop it. Here's what your pan should look like. And people loved it. They were like, they liked it better than just watching because they had to go out and buy the miso and the tahini and the kale and cook up this thing. And then when they ate it and they were like, I can't believe I made this. That's what it's just so heartwarming is to see people like shocked at their own skills.
Yeah. Yeah. But I
And
mean,
then the
even
other
to be
part of
able,
the jumpstart that we didn't talk about,
oh yeah, go ahead.
sorry, I was going to say the other part of the jumpstart is that we do labs. So we draw labs before and after. And I wanted to show the participants that they could see in just 1 month. We also did their weights, their BMIs, their blood pressures. So like you could lose a little bit of weight. And we looked for about like a half a pound to a pound a week, just a nice, healthy, it was the side effect of eating well, not like the primary goal. People's blood pressure dropped significantly, like 10 points of the systolic and 8 points in the diastolic in 1 month. Total cholesterol and LDL cholesterol dropped significantly, about 40 points and 20 points. And
Wow.
then we also checked liver enzymes and hemoglobin A1C and fasting glucose for like a diabetes marker or pre-diabetes marker. And that drops an average of 0.2 during the month. So if you're like pre-diabetes at 6.0, for example, you on average, you'd be 5.8 at the end of the program. And then the hugest drop was an inflammatory marker, because so many people have this chronic inflammation and it drops 32% in 1 month, like
Wow.
so quickly. And that was measured with something called an HSCRP. So we were just kind of blown away, the physicians who were running this, by the results we were seeing in such a short amount of time, which, fueled our desire to keep going with this program and our plant docs efforts. But I did collect data over the first like 2 to 3 years and published it last November in the American Journal of Lifestyle Medicine, because I wanted to prove that what we were doing wasn't just something I made up, and but it's actually statistically proven to do these things on average. So.
Yeah, amazing. So do you have any, I know that those were kind of, I mean, that's for your entire cohort of people that went through the program, the average improvement. Do you have any cases that kind of stick out of people that you've worked with?
Yeah, there's this one woman I always tell her story, Deb. She was from upstate New York, and she was my first remote participant. But she was someone who she's Italian, so she loves cooking with her olive oil. And she was someone who considered herself a very healthy eater, which is something I see a lot. So she takes the skin off the chicken. She eats more fish. She doesn't really eat a lot of red meat. She doesn't eat McDonald's and French fries in general, but she cooked with a lot of oil, and so I would say she was pretty much kind of like Mediterranean, but maybe didn't eat as many whole grains as we kind of teach, and maybe not as many legumes, and more this chicken fish situation. And she was recently diagnosed with prediabetes and then diabetes. She went over the cutoff, type 2 diabetes. And also her LDL cholesterol was quite high, and her doctor wanted her to start a statin and metformin. And she went to the doctors, and I think this is not at all unusual. Her doctor said, "This is genetic. Look at you. You're thin." She probably weighed 115. She's little something. She's very active. She hikes all the time. But, you have this high cholesterol and you have diabetes. So look at you. It's got to be genetic. You need to go on these two meds. And she was like, "I can't do anything to change my diet." And her doctor said, "No, it's not going to make a difference." But she found me because her brother had done the program, who lives in Providence. And so she called me and said, "Can I please do it remote?" And in 1 month, she had a normal A1C, and her cholesterol came down like 50 or 60 points. Because she was, I mean, her LDL cholesterol came down 50 or 60 points. She
Wow.
was one of those like A plus students, though. Just,
Yeah.
there's like a range of participants. Some people kind of go in 50%, some are like 80-20. She was one of these, I'm going in 100% and I'm going to give it my all. And if it doesn't work, okay, I'll accept that it's genetic and I need to take these meds. But I just, I love that story, because I think that is such a, I don't know what the word is. It's like a mistake to me, but I was trying to think of a gentler way to say it, that people are told that their conditions are genetic. And to me, that means give up. What you do nutritionally is not going to matter, and just take these drugs. And I just think that's so unfortunate.
I agree. And you're right in that it is something that happens a lot, unfortunately. I've heard this story several times from many different people who say that, they've been diagnosed with whether it's diabetes or even a cancer diagnosis, and they're coming to their doctor saying,
Yeah.
what can I do? Right? How can I
Yeah.
change my lifestyle to give myself the best outcome here? What can I do
Yeah.
to
I
maybe
want some
prevent these
control of my health.
medications?
Yeah.
Exactly.
Totally.
And
Yeah.
they're being told there's nothing that you can do. In fact, you just continue doing what you're doing because it doesn't really matter if
Mhm.
you change your diet, right? I mean, people are being told this who are getting these life altering diagnoses of things like cancer, and they're being told it doesn't matter what you do, just get the
Yeah.
treatments that we're telling you to get, like the surgeries and the chemotherapies. Um, so,
Can I
so,
tell one more
so,
story?
yes, please. I would love to hear another story. Yes.
I had this other participant for the Jumpstart, Carol. And when she came in, this was when we were doing the in-person one. So we weighed her on our scale and took her blood pressure. And there were 3 doctors that we were all doing the program together at the time. And her blood pressure was like 200 over like 110. And she was overweight, high cholesterol, like had like all these things. And we were all like, and one of my partners said, "This isn't okay. Like, you need to go to the ER." And, you can't just do this. Like you need to do. And she's like, no, I've been on all these hypertensive meds. They have terrible side effects. I really want to just try this. I promise, like, I'll be an A student. Like, she was one of those people who really just wanted to try it. And so we were like, okay. So she, at the end of the month, she had dropped her blood pressure to like 160 over 95. You know, it was still like high, but going in the right direction.
Yeah.
And I, you know, and we don't follow everyone after the program, but 3 months later, she sent me a picture of her blood pressure reading. It was 120 over 70, and
Ah,
she just stuck with it and all on her own, and she just kept up what we taught her. And it gives me chills every time I tell that story that she did it. No meds. And it's possible.
yeah. Yeah. And it's the better option too, right? It's uh taking a medication to decrease your blood pressure from 200 over 100 down to 120 over 70 is not the same as doing it through the diet and the lifestyle, right? Like helping your body actually heal itself instead of just falsely decreasing your blood pressure using medication. It's not the same. And I think a lot of people think, well, um, I'm just going to take the medication because I'd rather just live my life the way that I'm living it. I'd rather just eat, the standard American foods and not have to get up and go to the gym or, whatever it is. Um, but not realizing that the medication isn't the golden ticket. It doesn't do the same as what lifestyle can do. Um, because of those side effects of the medications, it's not going to help you feel better and have more energy and just get down to just like overall health in your body, right?
Yeah. Yeah,
Um,
the food is medicine approach is changing our body at like a cellular level. So
right.
where the actual function of each individual cell in the body is changing, our organs are getting healthier, and it's changing the lining of the blood vessels and how the smooth muscle reacts that's the underlying problem of high blood pressure in arterial disease. Meds aren't going to be addressing that. And it also has a huge impact on our gut biome, which that's like a whole nother hour topic on itself because the gut biome plays such a huge role in our metabolism, our mental health. Just like every body function is dependent on a nice, healthy, vibrant, diverse bacterial population in our gut. And I think we're just beginning to appreciate how huge that is to human health.
Oh yeah, absolutely. And it's interesting talking about all the different places in our body where we want to see health improvements. And you think about, okay, well, there's a medication for all these things, right? There's a medication to lower your blood pressure, there's a medication to lower your cholesterol, there's a medication to help with reflux, with constipation, with eczema, whatever it is that you have. Or instead, you can eat a plant-based diet, which helps improve all of those things, right? It's one thing. And by the way, it's a wonderful way to live. It really truly is. Once you go through something like what you offer, which is helping people understand what to do and how to do it, and get it to where it's just second nature. It's just this is the way that I live now. I mean, that's how I feel now is that it's not difficult for me because my pantry looks a certain way, my fridge and my freezer look a certain way. I eat the same similar foods all the time and it's just what I do now. I don't really have to think about it anymore. Once you get to that point, it's just such a wonderful way to live because now everything about your life is putting you into that, better health. Instead of removing, like you said earlier, instead of removing health by everything that you are doing, you are actually gaining health.
And we're helping planetary health. It's I don't think it's any coincidence that the diet is the best fuel for the human body and all our cells in our gut biome is also the diet that is best for the earth and our planet. Water usage, carbon emissions.
Yeah. I mean, it is kind of, I don't know, logical, right?
Yep.
It's intuitive that if it happens to help all of these amazing things, including our own health in so many different ways, why isn't this just what everyone's doing?
I like to
Yeah.
think they will be
Yeah. Me
in the
too. Me
future.
too. So tell us a little bit more about what exactly your program looks like. If people, so you are doing both, are you doing any in person anymore, or is it all virtual?
Um, we mix it up, but so the last one we did in the fall was a hybrid, but the next few that I think we're going to be doing will be fully remote. It's easier to focus on everyone when they're all either in person or on the
Yeah.
computer than half and half. So I think that's what we've been doing in the winter anyway, because in the north, people don't like to drive at night or in bad weather. So that we started doing the January one fully remote for like the last 3 years. But so yeah, fully remote. You sign up on plantdocs.com under our programs and jumpstart your health. And then once people sign up, we start like communicating. There's some videos to watch. We always have homework. We have people watch Forks Over Knives before the program starts, so we can kind of talk about that. We use all different kinds of tools that I pull from the best experts and my teachers and mentors across the United States and globally. So I don't feel like I want to reinvent the wheel when Dr. Greger has made this amazing app that I love to
Right.
use, for example. Like, so that's how we work. And then the cooking classes, the rest, there's like a portal that everyone has access to with all of our resources and all the recipes. And so you get the ingredients before the cooking classes, and we all cook together so people can ask questions. We can slow down to make sure everyone's caught up. And at the end of each cooking class, you've made a breakfast, a lunch, and a dinner. And then
Wow.
plus we've talked about ways to like repurpose the dinner for other dinners or lunches. So I feel like it helps, empower people and give them the tools to be successful. And then, so the cooking classes are our second and fourth class, and the first, third, and fifth are educational talks, discussions, and activities. And
Great.
then there's some videos. I'm accessible to everyone throughout the entire program by text, by email, by phone call. So it's kind of, I'm there for everyone. I just want everyone to succeed. So if people are having trouble, I want them to reach out to me. And then at the end, I meet with everyone one-on-one. So the scope of my practice as a primary pediatrician, who's also board certified in obesity medicine and lifestyle medicine, I feel like I'm limited as far as I don't want to adjust people's medication. And a lot of times people need that if they have type 2 diabetes or they have blood pressure meds and they start really doing this. They don't need as much medicine because their bodies are already starting to heal themselves. And that's where this partnership with Lifestyle Telemedicine comes in, that I'm really excited that we're going to be launching for our January Jumpstart.
Yeah, I'm really excited about that too because, as you and I both know, when you work with people who are very motivated to make lifestyle change, we typically do see improvements pretty quickly. And because of that, we have to be on top of it, especially when you're on medications. And like you just mentioned, especially those diabetic
Mhm.
medications, blood pressure medications, you can become over medicated very quickly, which can be dangerous, right?
Yes.
So, so the nice thing about us partnering together is now you've got this team of doctors who are licensed in all 50 states, DC, can see patients internationally, that whoever signs up for your program, if they feel like, well, I don't know if my doctor is going to be supportive, or maybe I don't even have a primary doctor right now. I want to be safe in doing this. Now you'll have access to one of our doctors who really does walk you through the whole program, making sure that you are safe and that you're getting off medications as able. and doing it in a way that makes sure that you are safe during the program so that you aren't becoming over medicated. We make a plan from the very beginning so for instance, people might be on 3 blood pressure medications. And that sounds like a lot maybe to some people, but we see it all the time now. People are on multiple medications for blood pressure. And so which medication do you start with? Which one do you remove first? What dose, and what numbers are we looking for? How low can it get? What are the symptoms? So all of those things that we can work with people on so that they can be very successful and hopefully get off those medications throughout that time. And I also want to go back to that first story you mentioned with Deb, I think you said. Um, how incredible that she got into the diabetic range, which is, could be 6.5% A1C, or maybe she was even a little higher than that. And then to get down into the normal range within a month is pretty incredible because, as you and I know, your red blood cells change over every 3 to 4 months. So typically we wait to check the hemoglobin A1C so we can get a truly new average of what that hemoglobin A1C should be at that time. So to have that improvement within a month is still taking into account those 2 months prior to when she was in the program, right? So that's an even bigger improvement
Yes.
because she had enough change in that 1 month to completely change the 3-month average. So that's really incredible.
Yeah.
Yeah.
So for like, in what you were saying, like sometimes people have doctors and even have subspecialists, but they may not be informed about how powerful changing to a plant-based diet can be for even these diseases that they specialize in. So I've actually struggled with the local endocrinologists really getting this. And they're very hesitant to drop the insulin doses, and they're telling patients to take, sugar, like have sugar snacks when they're having lows rather than back off on their insulin dose. So I really am excited to be able to have lifestyle medicine doctors that are informed, that can really help our participants succeed and really help them get off their medicine if it's indicated.
Yeah, because, fortunately, we get to see those patients who have those quick improvements and those really significant improvements by just changing their lifestyle, their diet. And so we know what to do, for instance, with the insulin right away. Whereas you're right, and I've actually had this happen with a couple of patients that have come to me who have a specialist, like an endocrinologist, who's following them, who's a very smart physician, right? But because they don't see people getting better over time, it's so rare that they see that they just don't have the experience. And not only that, like you said, they don't know the power of changing the diet in this way. They don't know that you can drop your blood sugar so quickly, so significantly, that they're not even considering, like, wow, I really got to be careful about this insulin and make sure that I'm decreasing it over time. That people can get into trouble. And I remember this one where this woman was on so much insulin, and her endocrinologist wasn't decreasing the insulin, and instead she was, these glucose tabs that you can
Yeah.
prescribe for people on insulin. And this is to really be like, maybe on those occasions where it drops sometimes. It shouldn't be used every single day, right? That there's a problem if you're using it every day. But she had just piles of these in her purse, and she was just popping them constantly. And she said, I just can't keep my blood sugar up. And here she is on just a huge amount of insulin. And I mean, the first thing we did was decrease it. I mean, honestly, we decreased it by like 90%. It was that much that she needed to decrease it by to get to the point where she wasn't just having to take these sugar tabs all the time.
Mhm.
So I've seen it personally. So absolutely, that is an issue. Is that we know the power of this, and unfortunately, there are a lot of specialists and primary doctors that just don't see the power of this often enough to know what to do with the medications.
We also have a lot of people on statins, and
Yeah.
so I know that's gonna come up. People are asking me all the time about how to deprescribe a statin, how to get off of it, or how not to start it in the first place. So
Yeah.
that'll be nice as well.
Yeah, yeah, because there are going to be certain circumstances which staying on a statin makes sense, but I would say for a lot of people, if you're just on the statin because your cholesterol was high, there's a good chance that you can decrease your cholesterol through lifestyle changes, and then we can do a trial off the medication and then retest you to see if you even need it, because we can use all sorts of tools to determine whether or not a statin even makes sense for you anymore, right? And this is evidence-based. This is looking at, using algorithms that a lot of primary doctors and cardiologists use to determine if someone is a good candidate for a statin. So that's something that I do a lot as well, is help people making those choices.
Yeah, that's great.
Yeah. So, okay, so let's talk about then how people can, I know we mentioned it earlier, but for those who maybe didn't hear, where people can join your Jumpstart program that starts in January. That and I believe that you have kind of two options where people can just join the program if maybe they're not even on medications, they don't feel like they need the doctor support, and then they can also add that doctor support if needed. Is that right?
Exactly. So they
Okay.
sign up for the Jumpstart Your Health under plantdocs.com, and then they can have that additional option to choose this medically supervised care, one-on-one care with a lifestyle telemedicine doctor who's licensed in your state to get that extra piece.
Yeah.
And then that will be like a separate process.
Yeah, and so you can go to Dr. Musial's website, plantdocs.com. We also have the program listed on our website. So if you go to our website, lifestyletelemedicine.com/plant dash docs, then you can also access the program from there as well. So either way, you'll be able to find what you're looking for there. All right. I want to just, I know we've just got a little bit of time left. If people have any questions, you are welcome to put any questions that you might have into the comments from wherever you're watching from, whether it's YouTube or Facebook or Instagram. If you put your comments into, put a question into the comments, we can pop those up and answer any questions that you have about maybe the program or anything to do with really lifestyle medicine or a whole food plant-based diet. And yeah, we'll just see if anybody has any questions for us. Okay, Dr. Musial, do you want to read that one for me?
See, I have heart disease and esophageal dysmotility, trying to follow a plant-based diet. However, I struggle to follow this diet, which requires variety and large portions. Any suggestions?
Yeah, what do you think?
What are you trying to follow? I guess the large portions, I'm just questioning, is that because you're saying because the food is not as calorie dense, you need to eat more volume? Or is
Probably, I'm thinking that
that what she's getting
that's
at?
probably what she's getting at, is that because it is plant foods are typically lower in calorie density,
Mhm.
you tend to eat more food to get the same amount of calories that you would with a more animal or processed predominant diet.
So she might benefit from, more smaller meals,
Yeah.
like 4 or 5 meals a day rather than trying to get everything into 3 meals a day.
Hmm.
Um, I
Yeah,
would
I agree.
think that, getting rid of the oils and the fried foods, will kinda help everything. I don't know if it's a texture thing either, like if things need to be softer, um, for the dysmotility, so
Yeah.
sometimes these nuance things, it's helpful to have like a one-on-one consultation to go over the specifics, and where having a lifestyle telemedicine doctor can help, with this kind of individualized nutritional needs.
Yeah. Yeah. I completely agree. And I think one more thing, she was talking about variety,
Mm,
and it is important to get good variety so that you have a good, healthy microbiome, right? But if you're brand new to this, sometimes, as your gut microbiome is changing, you can have some extra bloating, you can have some GI stuff. as you're healing and as you're, really improving that gut microbiome over time. So I usually will tell people, to add things. So like, for instance, if beans really cause you to get quite bloated, start with one type of bean, and especially lentils are usually more easy to digest and handle. So you start with that, and then you just kind of increase over time, not only the amount, but the different types. And that is, like you said, something that really should be discussed with one-on-one to really come up with a plan for that. So thank you for that question. That was great.
Mm.
All right, let's see if maybe we've got time for one or two more questions. If anyone has any other questions for us today.
Happy, happy, joy, joy. Do those drops happen even for maybe the drops in the happen even for folks who eat healthy but are pescatarians or vegetarians?
Yeah, so I can start with that. So yeah, in fact, I had a patient. I actually interviewed her, so you can go back and look. But her name's Amy Garoso, and she came to me, kind of like your patient that you mentioned before, Deb, where she was, had a normal BMI, was otherwise living a pretty healthy life, doing
Mhm,
exercise and eating more of like a Mediterranean kind of pescatarian type
mhm.
diet. And her cholesterol was high. And she said, she came to me and she said, I don't know that going plant-based will really help me. I think this is more genetic because really I'm quite healthy already. And so I had her do a similar jumpstart program to what you offer, but it's a 2-week one. And her cholesterol dropped, I want to say it was by 40 or 50 points, her LDL, down into the normal range. I mean, it was incredible, the drop that she had. So yes, it isn't just things that we see in people who have multiple chronic diseases, who are otherwise, unhealthy, where we see these big drops. We can still see them in people who think that they're doing all the right things and are still having some health issues.
I just wanna add that I often get, vegans that come to me and they say I'm an unhealthy vegan. I'm one of those junk food vegans. And just because they're eating all these plant-based foods doesn't mean that the quality of the food, is great. It might be very processed. It might have refined flours in it. It might have sugar. It might have all kinds of oils and fats, palm oil, coconut oil. So sometimes that's like a bigger change when someone's an unhealthy vegan than when they're an omnivore, like a healthy omnivore. So it's always not just about like the label of the diet they've been eating, but really the quality of what they've been taking in, how processed it's been, and how it's been prepared, if it's fast food or fried. So some of the most dramatic drops we've seen are in vegetarians, vegans.
Yeah, absolutely. Yeah. So yeah, all right, let's see if we have any other questions, and if not, we can wrap up. Okay, all right. Well, um, thank you so much, Dr. Musial, for talking with us today, and thank you for what you do.
Thank you.
Because I know that this is not a venture to try to make lots of money. It really is out of passion, right? So I know that firsthand. Um, and we need more people like you doing this. So I really appreciate that you have dedicated your life to helping people with this.
Thank you, Nikki. And
Yeah.
thank you so much for this collaboration. I really think like together we can, affect more people in a positive way.
Yeah, I agree. All right. So if you want to learn more about Dr. Musial and what she does at plantdocs.com, and then also if you're interested in signing up for one of her Jumpstart programs, plantdocs.com is where you want to go. And again, if you want to add medical care to that program, we are the doctors that will be helping with that. So we would love, 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 love to help you on your journey to better health. And you can visit us at lifestyletelemedicine.com. like I said earlier, our doctors cover all 50 states, DC, and even if you live internationally, we can do a consultation with you. And, you know, maybe it's you are on a lot of medications and you do need that help to make that transition and get off those medications as able. We would love to help you with that. Maybe you are already plant-based and you just really want a doctor who's supportive and lives the lifestyle, right? So they really understand where you are. We would love to help as well. And if you want to give us a call, we have our wonderful patient care coordinator, Susan, who, if you have not talked to her, I would highly recommend it. She's wonderful, and she can talk you through which doctor can help you wherever you are living, and also just kind of the process of getting started with making an appointment or signing up for one of the programs, one of the partnerships, such as Plant Docs. So please visit us. We would love to see you. And thank you again, Dr. Musial, for being with me today. Until next time, I'm Dr. Nikki Davis with Lifestyle Telemedicine. Thanks
Bye.
everybody for watching.